Hey Bella, I'm Dr. Wu, nice meeting you. Yeah, thanks for coming in. So what can I do for you today?
So I have like a lot of problems with like my neck and like my back.
And how long have you been having this?
It started kind of when I was like 21. Like I think for the last like 2 years it's been happening as I got older. I drive more, and then also I have a desk job, so I'm always kind of like hunched over because I can't really see the screen, so I have to get like really close to it. And I think like that kind of messes up my neck a lot too.
Does it give you headaches?
Sometimes it does.
Okay.
It's not like really bad, but sometimes they do kind of bother me. Like if I can't fully like crack it and I kind of just leave it, it'll start hurting a lot. But like towards over here, like the back part, it doesn't really hurt like up here. It's kind of just like back here, like where the neck area is. One time I did try to like massage it, and I don't know if I pushed like a pressure point or I pushed too hard, and then I kind of got dizzy when I tried to like massage it out because it was bothering me because I couldn't crack it all the way, and I kind of just did this and like I pushed, and then I did get like really lightheaded.
Alright, so essentially what I'm going to do now, Bella, is I'm going to use this. This is what we call a mild vision device. This is FDA Class 2 diagnostic tools. Mm-hmm. So basically what I do is I'm going to dabble on the back of your muscles over here. Mm-hmm. What I'm trying to see is if they're balanced or not. If they're too tight or too loose. It's another indication of what's going on within the spine.
Oh, cool.
Yeah, so what I want you to do is go ahead and put your hands on the side and look straight. Mm-hmm. And at this point, just keep looking straight, no talking, and just breathe at me regularly. Oh. Okay? Alright, here we go.
Release back. Left. C3.
There we go.
Left. C7. Left. T4.
Alright, so before we show yours, but let's take a look at what's the optimal zone should look like. So what you see over here is that left and right, they should be balanced, and they should be within the color of a green. That's what we call the optimal zone. And this is over here, that's you right here, right? So this is the left side, this is the right side. So the color that we wanted to pay attention to are either the red or the green or the yellow. The red basically means the muscle is very tight, and the yellow means the muscle is very weak. So as you can see, you have a lot of tightness around here on the left side of your spine over here, from the neck all the way to the upper lower back area. So that tells me that this is another indication of what's going on within the spine that's causing this issue that you're experiencing right now. Mm-hmm. This number over here, EP stress score 156, this is all these numbers add up to be 156. The ideal zone that we're shooting for is between 90 to 110. So obviously we're over that. So this is another indication of what's going on.
What is the percent on this side of me then?
So basically, percentage means how far deviation between the left and the right. So as you can see, this one and this one has about 66 difference between the left and the right. Basically, that's what it means, right? So we want that number to be as close to zero as we can. So we're going to make sure that we protect your uterus and your ovaries. So we're going to put on the heart on right there.
Cool.
Just like that. So first part examination of what we do, Bella, is we're going to do visualization just to see if there's any skin texture changes around that area. So based on what I'm looking at over here, you got some swollen over here in the lower part of your neck and the upper back and mid-back junction right there. Mm-hmm. And then also you got some stuff going on over here on the left side of your hip joint over here. So that's one of the indications that tells me that we should investigate more about these two areas. Okay? Mm-hmm. All right. Cool. And the next thing that we're going to look into doing is we're going to use a nervous scope. I'm just going to go ahead and scan your back now.
Okay.
All right. So we're going to go to the full spine first. We just want to have a general idea about how the needle is going to move on your spine first. So we've got some stuff going on over there. And now we're going to break it down now. Okay. So what we look for is we'll look for a quick spike. We're not looking for a big, like a general movement, but we're looking for a very sharp movement. So that gives me a good indication. Right around there we have it a little bit. All right, so let's take a look at your neck. So we've got some stuff going on. More so at the lower neck area. So I'm just gonna move you around to feel how they move, okay? All right, you just go ahead, relax for me. There you go. So we check the sacrum, see that's tuck in. So what I feel here is a little bit of restriction right there. Is that sore right there?
Yeah.
Yeah, that's painful when I apply. Okay. How about on this side, center or left?
I like less.
Left?
Yeah.
Yeah. I do feel restriction on the left side over here. All right. What I want you to do is go ahead and put your arm out like this for me, just like that. Okay. And then you can go ahead and relax your hands onto my hand, just like that. Okay. All right. So what I'm gonna do is I'm gonna rotate you away. I'm gonna feel the motion of the rotation right there. Okay. You can go ahead and relax. Yeah. There you go. Yeah, that's more restricted. Right there, stay right there, don't move. Yeah, this one's definitely looser right there. That's pretty good. Go ahead and put your hands down. So again, we just want to make sure that they move correctly. And if they're not, then most likely it's one of the indication that the bone is subluxated. Okay, so we got that, that's okay, that's moving okay. But this one's actually give you some trouble right there. Is that sore when I push in like that?
Yeah.
Yeah. Okay.
Yeah, the other one was okay.
This one's all right.
Yeah.
Yeah. So we got 2, 3, 4, 5, 6, 7, 8, 9. All right, Bella. So we got a couple bones in the back that's subluxated. We got a T2 and T9. Now T9 goes to your digestive systems. So like after you ate, people who have T9 that's subluxated, after they ate, they usually feel like a bloating or fullness or even gassy. Sometimes they even feel acid reflux in that situation. Do you feel anything like that?
Yeah, like after I eat, I tend to feel like really full even if I eat like a little bit. And then I do have like, I think it's acid reflux or a lot of acid buildup.
Kind of build on and comes back out this way?
Yeah, it kind of like gets
Yeah.
stuck like somewhere.
Okay.
Mm-hmm.
All right, so that could be one of the reasons why you can potentially feel that way.
Mm-hmm.
Now T2 usually goes out to your lungs and your heart.
Mm-hmm.
Do you have any like a respiratory or breathing issues?
Yeah, I do have asthma.
Okay, so that kind of explains why that can be the reason here. Okay. All right, Bella. So this is your X-ray, looking from the side and looking from behind. So the first one we're going to take a look at is the side X-ray. The reason is because you want to see the curvature of the spine. Okay. When you're looking from the side, you should have 3 different curves: lower back, mid back, and the neck. Now, this yellow line is what we call the optimal curve. The reason that we want to have an optimal curve because the curvature is acting as a suspension system for your spine. They will help you to dissipate the forces and the trauma they put in your body. For example, every time when you do an exercise, or if you just by simply walking, there's always going to be impact onto the body. But if you have a good curvatures, it's going to help you to dissipate the forces, and that's how can you keep your spine healthy. Okay, so the yellow line is what we're trying to achieve. Lower back is actually pretty decent because you see the front of your spine is almost touching the yellow line, so that's decent right there. The mid back, you start out pretty good from the bottom up. This is pretty good because the back of your spine is touching the yellow line, but over on the top, over here, you're actually over the yellow line, so that means that your body starts to slouch forward a little bit like that. And then lastly, you can see the neck, where you're kind of off, you're off on the yellow line. You have what we call the straight neck. So when you have a straight neck, you lost the protection, and so any trauma that you put in the body over here can amplify the injury in that way. All right, so yellow line is what we're trying to achieve for. Okay, and this is your X-ray looking from behind. So we're looking at your back. This is the left side, and this is the right side. The first thing that we want to see is, hey, is your spine straight or not? As you can see, your spine is kind of curvy to the right, back to the left, going to the left side, and going to the right. So your spine should be straight, but there's multiple curvatures within that. The reason is because your pelvis is off. Pelvis is really the foundation of the spine. So when your pelvis is off, your spine will start to adapt it to it. But the reason that your pelvis is off, couple of reasons. Number one is you have what we call a genetic variation or congenital variation. What I notice over here is that the distance between your femur head and your femur bone over here, the distance over here is a lot more smaller compared to over here. So this could be that you were born with that, right? So if you're born with it, then every time when you walk, your pelvis is going to drop down this way, okay? Because this is shorter, this is longer, right? So it's going to drop down like that. And when that happens, your pelvis will start to self-adjust towards that dysfunctional joints over here. So that's why your pelvis will start to misalign over time. It's also called a subluxation. So after analysis, you do have a misalignment of the pelvis, which we need to take care of that. Okay, so if your pelvis or the foundation is off, then your spine will start to adapt into what's going on down there. So that's why you have stuff going on over here. We gotta take care of that first. Yeah. So this is gonna be a little bit different, Bella. So rather than me try to pull it in, I'm gonna push in for you. Okay, I got you. Okay, just like that.
Cool.
That's pretty good right there. All right.
Cool.
That's better. Okay. All right, just walk around. Feel the difference. Actually, tell us what's changed. What's the difference?
Yeah, it feels like better, like right here. I don't know, I feel like even kind of.
More even?
Yeah, I don't know how to explain it, but like it just feels like it started to like balance, like.
Okay.
Yeah.
All right. So that's what happened when we adjust your pelvis. Your body will start to balance better in that way.
Yeah, because it's not just like I feel everything kind of like floating.
Good. All right, we got a couple more bones need to adjust it. Okay. All right, Bella, let's go ahead and have you step on the platform over here. Put your face right here for me. Okay, hands on the side, grab onto the handlebar right there. Cool. All right, I'm gonna lower you down. It's gonna slow down towards the end, so just relax, okay?
Okay. Whoa.
All right, so we're gonna adjust your T9 and then also your T2 walls. We're gonna adjust from the right side over here. So I'm gonna come around this way. Go ahead, lower your chin just a tap. Right there, that's good. Come on. Right there. Okay. All right, Bella. Just go ahead and relax your belly down. We're gonna set it down just like that. So just relax a little bit more. Good. Just like that. Good. That's pretty good right there. Good. All right, we've got one more over here. We're gonna set. Okay. Just go ahead and look down for me. Here, stabilize a little bit better right there. Good. And just relax your shoulders down. That's good right there. Good. Oh. So we always recheck after the adjustments. Make sure that we make a correction. And that is definitely moving better too. Is that less tender when I do this now?
Yeah, the first time you did it, it was like a lot like more tense.
Yeah. So that's what happened when the correction has been made, the bones in the better place, the inflammation will start to go down. All right, so that's it for that. The correction has been made, so they all moved it pretty well. There's a couple things that we're lucky to do. After adjustments, we'll always recommend patients to walk about 10 to 15 minutes before they sit down.
Okay.
The reason is because we want to continue to make sure that the joint is in motion, so it can heal better. Also, we're resetting the nervous system as well.
Okay.
Another thing is that you may or may not feel some soreness to the places I adjusted. If that's the case, it's okay. What I want you to do is I want you to ice it. Okay, don't put heat on it, put ice on it.
Put ice on it?
Ice.
Okay.
So what I would like you to do is 20 minutes for every hour.
Okay.
And do as many times as you need to. Okay? Yeah, and just pay attention to the changes and then kind of give me a rapid report next time when you come back in for the follow-up visits.
Okay, cool.
Okay? All right,
Thank you.
thanks.